The common perception of laser is to be used to try to get out of using glasses, i.e. for refractive purposes. Now, of course, that is an option, but as a glaucoma and cataract specialist, I use laser for more medical reasons. Post-cataract surgery, 20% of us will get something called the after cataract, or a posterior capsular opacification. Essentially, the inherent membrane that holds the new plastic lens in position becomes fogged over, which requires a small laser procedure to get rid of all that mucus that's accumulated. This is a 2-minute procedure, painless, using a contact lens with a YAG laser to the capsule. This will ensure that the vision gets much better to the level it was once the cataract was done initially. This YAG laser can also be used in situations where patients have narrow drainage angles. Of course, we can do clear lens extraction, but in those patients that are not keen for an interventional invasive surgery, YAG laser to make small holes in the iris is an option. Essentially, by making a peripheral laser hole in the iris, it allows fluid to drain through that hole, enabling the angle to open up somewhat. The angle configuration changes, i.e. the angle opens between 40 and 65% of people, which means serial follow-up afterwards to assess the iridocorneal angle is imperative. It may also mean that you still need lens extraction later down the line. Another option of laser for some patients, particularly when their iridocorneal drainage angle is deep with pigment inside and they've not had treatment before, would be something called selective laser trabeculoplasty. In the angle exist little pores where fluid drains out of. If one lasers those pores, an inflammatory reaction happens whereby those pores can open up. Hence, fluid can drain out of it. It's by no means a fail-safe procedure whereby most patients do need treatment later down the line, but it may keep you drop-free for a protracted period of time. Careful follow-up is the key after the laser to ensure that the pressure doesn't start creeping up.